We've been covering this story now for the past couple of days, and now, according to Sacramento County Health officials, they are investigating a case of monkeypox connected to a recent trip to Europe where other positive cases have been detected. Let's take it now to ABC 10's Lena Howland, who is in studio. Lena, we've been dealing with COVID for the last 3 years. What's the situation now with monkeypox?
Well, the county told us that this is just a probable case of monkeypox for now, but based on symptoms and preliminary testing, they say it is likely the virus. Now, Sacramento County Public Health Officer Dr. Olivier Cassirier says the person under investigation for the virus recently traveled to areas in Europe where cases of monkeypox have been confirmed. There are more than 200 confirmed cases worldwide, and presumptive cases are being investigated in Washington State, Florida, Utah, and New York right now, in addition to this case now in California. She would not confirm when the patient got back or what airport they landed at, but she did say the potential case was reported to the county on Saturday. Preliminary testing was done, and they are now waiting on confirmation from the Centers for Disease Control and Prevention. She said the patient is isolating at home, is not hospitalized, and has not been in contact with anyone else since reporting this to the county, adding that risk to the general public is very minimal. The county is now working with the State Department of Public Health to conduct contact tracing.
If people are exhibiting some of the symptoms, especially if they have a rash that is unusual, that they contact their healthcare provider to have that checked out and make sure that if we need to do further investigation, that we can do that right away.
So we don't actually think it's going to turn into a COVID type of outbreak. We're learning some new things about the transmission because we're seeing it primarily in a community of men who have sex with men, suggesting either that the virus has evolved and it's now being transmitted more sexually, or that it's really that prolonged contact, that close, intimate contact that's leading to this spread of the infection.
And that was ABC 10 medical expert Dr. Pyle Coley. She says monkeypox is a viral pox-like disease from the smallpox family, only milder. Health officials say it can be transmitted by respiratory droplets, contact with body fluids, or contact with an infected animal or animal products. Symptoms for monkeypox include fever, headache, muscle aches, backache, swollen lymph nodes, chills, and exhaustion. But a lot of people may just see the rash as their first symptom. And that can often begin on the face before spreading to other parts of the body. Dr. Coley says while this virus is nowhere near as transmissible as COVID-19, you can still protect yourself from it by doing the same things like masking, social distancing, and using regular household cleaning supplies on surfaces. Well,
Okay, Lena, that's a lot of information. I know we're working hard in the newsroom behind me. Much more coming up in our news at 5 o'clock. Again, 200 cases worldwide and maybe one in greater Sacramento.